Hi guys, welcome to Osmania Rocks. Myself Dr. Vinod. I am Assistant Professor, Department of Nuclear Medicine, NIMS Hospital. And today we have a very ranker 280 All India 2023 284 ranker, Dr. Kaushik, who is pursuing his general medicine. Now he is a third year resident. We want to hear all your queries through him.
Yeah. Hello everyone, I am Dr. Kaushik Tangada, currently a third year internal medicine resident from Nizam's Institute, Hyderabad. I have secured a rank of 284 in the NEET which was conducted in 2023 and I have chosen internal medicine residency from NIMS. I have done my undergraduation from Osmania Medical College. I belong to the batch of 2K16.
Oh, very well that. What factors mainly help you to in deciding the branch, which is like because you got a good rank, were you like in your UG itself you are inclined to general medicine, or else after NEET you decided?
Yeah, so that's a good question. The thing is, I feel branch is the most important thing what one has to decide. It is the one which stays with you for with you lifelong. So that is the most ultimate thing which you have to decide. So irrespective of the rank, whatever rank you get, you have to be fixed towards your branch. So ideally, in ideal scenario, the branch has to be decided prior to giving your NEET or prior to giving your NEET. So I have decided internal medicine as my branch right in my fourth year itself. That one was the one which has attracted me while I was preparing, and while I was doing my final years, during my internship, and during my NEET PG preparation days.
So as you thought about the branch in UG itself, you had to work hard to secure that good rank to
Yes,
pursue medicine.
Yes, general medicine currently is one of the. I mean, it's from the past, now, and future. It will be the branch which is always a sorted out one as for someone who wants to pursue their post graduation. So it is a highly competitive branch. So you have to decide it prior to it. It's better if you decide it prior to it. It's okay if you decide branch after your NEET PG rank as well, but you have to be fixed towards your branch rather than being fixed towards your program, residency program where you're doing and all. It's the branch you have to decide first. So
okay, Kaushik, and after that in you got 284, so you had options of even Osmania or else even other hospitals national level. So what all factors attracted you towards NIMS?
Yeah. So I come from Telangana itself. I am from Warangal. I belong to Warangal, and I have been in Hyderabad for the past 10 years. For my schooling, even my secondary schooling and secondary education, and my UG, I belong to Hyderabad. So for me, Hyderabad is like home to me, and definitely I was preferring to be very close to my state itself while doing my PG. So in state, I feel in Telangana, I was very lucky enough. I was lucky enough to get a good rank at that point in time, and I was lucky enough to be able to get my dream branch from Nizam's. So
compared to Usmania, what all factors helped you to or else propel you to take NIMS general medicine?
Yes. So initially, I have done my undergraduation from Osmania. I have done my internship also from Osmania General Hospital as well. So I know how internal medicine is at Osmania.
You wanted to experience a new hospital.
Yes, I wanted to experience a new hospital.
So
And for that, there were many seniors of mine who have done in UG in Osmania and were doing PG in
NIMS. So all these things help
So
you.
all these things helped me in sorting out a college well.
Okay. And Dr. Kaushik, for your rank, there were a lot of options, even in national quota like BHU, Lady Harding, RML, and even in Bangalore. So, why did you choose NIMS as a branch, NIMS as a college?
Okay. For my branch, actually, for my rank, the rank which I got at that point in time, I had an all India rank of 284. The options were not many, but yeah, I definitely had other options before considering NIMS as well. So in my scenario, I could have had an option of maybe getting into LHMC Delhi or UCMS Delhi or an IMS BHU and BMCRI Bangalore. So these were the options, four colleges which I was eyeing on parallelly to NIMS. But finally, I have decided to stick on to NIMS. So for that, I have my own reasons. One is I felt I have been to BMCRI, I have been to IMS BHU, I have talked with the people over there. I feel being during residency, being at a hometown is much more advantageous. That is the first point.
Yeah.
And the second thing is, even the residency program, the way it is designed, it is very much effective, efficient way in NIMS as well. When compared to residencies all over Delhi, the state colleges of Delhi or IMS BHU or BMCRI, which also I could have gotten an all India quota with my rank. But there is an example. There are my colleagues of mine who had better ranks than me. They have secured the all India rank 20. There is one who has secured all India rank 80. There is one who has secured all India rank 40. They could have easily gotten colleges.
Almost all options.
All the options would have been open for them.
Still they choose NIMS.
Yes.
Yeah,
so and they consider it as their best decision and a wise decision.
Yeah. So because NIMS is almost as equivalent as all other national.
Definitely. It's almost equal. It's equal and even more I would say when compared to all the colleges of national importance. It's definitely on par with colleges of national importance. Yeah.
Okay. And thank you. After that, how many units or else how many seats are there per batch, and how many units in your department?
Yes. So I joined NIMS in 2023 September 5th. Now it's been 2 years have been in NIMS. So in our batch we had 15 residents. Okay. So 7 residents who have been joined through all India quota and 7 residents who have been joined through state quota. A total of 15 residents. But the our juniors, there have been 2 seats less. There are only 13 residents. 6 who have joined through all India quota and 7 who has joined through state. So in and around you have seats ranging from 15 to 13 every time in NIMS.
Okay.
So and the program at NIMS, you have 3 units basically at NIMS. Same alternating, I mean operating on a Monday, Tuesday and Wednesday basis, and getting repeated on Thursday, Friday and Saturday. Okay. There are 3 units basically at NIMS, having 2 OP days per week and getting an alternative Sunday rotation.
Alternate Sunday rotation.
Yeah. So total we have, as junior residents we have 15 per batch average, but now the seats have been reduced. So now the juniors who are my juniors are 13 members, and we have about 15 senior residents as well. And we have a faculty of 10 permanent faculty who are there in NIMS right now.
Okay. Yeah. Coming to the course fee and stipend, can you elaborate a few points?
Yes. So we generally at admission, no fee is taken from us. We are not asked to pay any fee. The admission, we have to pay a minimal admission charges, which ranges from 5,000 to 9,000 at admission. And our fee, which is we have a tuition fee which is cut from our stipend every month. So it's approximately 6,000 in first year, 7,000 in second year, and 8,000 in third year. So we have a deduction from our stipend itself.
Okay.
Yeah, we don't have to pay any separate fee for it.
Right. Okay. Yeah. Overall stipend?
Yeah, stipend, we have a pay scale ranging from 1,15,000 to 20, but we get it reduced. So we have tax reductions over it. We have tuition fee reductions over it. With all the deductions, you get a stipend about 1,04,000, which I am getting right now.
Yeah.
1,04,000 is a stipend which I got last month after my deduction of tuition fee of 8,000 in my third year, and with a tax deduction of 6,000 to 7,000. So I get a average stipend of 1,04,000 per month.
Okay. Okay. And what are the working hours, like daily working hours?
Yes.
How many patients you see in an OP day?
Yeah. On an OP day, basically here as a resident, your curriculum is different in different years. Mm-hmm. So first year you belong to the department only. So you belong to general medicine department only during your first years.
Okay.
So in first year you are posted into different units, changed every 4 months.
So
every
first unit 4 months, second unit 4
4
months,
months,
third
and
unit
third unit
rotation.
4 months. That is done on a rotation basis.
This is okay.
So every 4 months you will be in a
Different unit.
different unit. And here basically we have segregation of residents in 4 to 5 locations. One is an OPD where a resident from each batch, like from first year, second year, and third year, is posted.
Okay.
One OPD resident along with senior residents and faculty. One is posted for a month, entire month in an OPD.
OPD.
Yes. And the other 2-3 residents will be posted in emergency for a month.
EMD.
Emergency. So entire month you will be in EMD itself.
So you will they on first hand they see a lot of cases like
yes. Right from starting, it's almost very hectic for a person. If you are not lucky enough, you would be the one who would be posted in emergency
EMD.
right from your first month.
day. Okay.
So that would be a nightmare for anyone. So.
But I think if someone who would have done internship like in a casualty in a government setup, they may feel little like adapted or else.
Yes, definitely that is there, but
that will help.
Even the emergencies here are very different. So how we will discuss how that is operated, because that's a nightmare to be in an emergency. So as a resident, you are posted at 5 locations. One is your OPD for an entire month you would be posted. That would be done on a rotational basis. And second is your emergency for an entire month you will be posted over there. And you have an ICU, a 16 bedded ICU, 16 to 20 bedded ICU. You have an ICU where you are posted a month. And you have 2 wards. One is a stable ward and another one is a step down ward. Okay. So it's a step down to ICU, one ward, and the other one is a stable ward. So these are the primary locations where you are posted as a resident in your first year. Especially so this is done on a rotational basis. Every month you would be rotated in these things.
So different units and different locations.
So while you are on wards, you would be in different units. So you would be in first unit, second unit, third unit based on your wards. If you are in your wards, you would be in first unit, second unit, third unit. That is either in a stable ward or a step down ward. Okay. Yeah. If in ICU and emergency, that doesn't operate according to your unit. You have to be there as a resident. Okay. So these all are done on rotational basis. Yes. These are the 5 primary places which you are going to be placed in your 3 years of residency. And first year you would be restricted to these 5 places itself. And during your second year, you get
peripherals.
Yes, exactly. During second year, we have peripherals. The duration of is about 9 months. We have a 9 months of peripherals.
What all departments will be posted?
Yes. So we are posted in every department, every other department which is in NIMS. We are posted in neurology, cardiology, medical oncology, gastroenterology, rheumatology, endocrinology. We have a full-fledged departments which are super specialty departments which are running on NIMS.
I think even geriatric medicine.
Yeah, geriatric medicine is a part of general medicine. It's a part of general medicine. It's not a
hematology.
Yes, hematology a month. You will be dedicated to.
So you get exposure to almost most of super specialty branches.
Yes, the exposure to. I mean, there is a good amount of coordination between your JRs and SRs. So when you are posted in emergency, you are posted along with an SR only. So you have a team of general medicine residents who are posted in emergency. So 3, you have one from each batch who is posted in emergency. Along with you, a cardiologist is posted for a
super
month.
specialty.
Yes, a rheumatologist posted for a month. A nephrologist
simultaneous
posted.
learning.
Yes. So it is the place where a group of 10-12 doctors for a month are posted over there. So you, as soon as the patient comes to an emergency, you are seen by different doctors. A general medicine one sees, a nephrology will give an opinion, or a rheumatology and cardiologist doesn't give an opinion.
So a stroke patient is simultaneously seen by a general medicine resident and even a neurologist.
Yes,
at the same time.
Yes, both of them same time, and based on whose intervention is more needed, based on that admission is done.
So based on good way of learning.
Yes. So you are positioned at the same place. So all 12 residents for a month you will be at the same place. So based on a patient, as soon as a patient comes, there is an stabilized by emergency medicine, followed by one who is seen by general medicine. Then further referrals will be done. And so by the end of a day, by the end of next 6 to 8 hours, we need to make sure that all consultations are done for the patient and make sure that he is admitted under some department, either general medicine or nephrology or a cardiology. Based on his disease condition, you have to make sure that he is admitted within 6 to 8 hours of presentation to emergency.
Okay.
So that is where our primary admissions are being done.
So that helps you to learn a lot from
Yes, that
all
helps
other
us
branches.
yes, have a good interaction with our senior residents. By that we definitely get a clarity on how to take our career forward. So
Even
it
exposure
helps
of
us,
a different branches also.
exposure of a
Super
branches more, and rather than exposure is more, and it gives you an idea these for you to pursue your further careers.
Okay. Okay. Yeah. Coming to the academics, how usual you give presentations,
Yes.
like classes.
Yes. So academics in general medicine, we have to have a dedicated academics at NIMS.
Okay.
So 8 to 9 is our academic hour. So
every morning.
every morning 8 to 9 is an academic hour.
Okay.
So we have 3 days as a combined academics and 3 days as academics at our department.
Okay.
So 3 days we have it at our department, where primarily we have seminars going on, we have a journal cup going on, and we have a case presentation going on.
Okay.
So case presentations done by final years, seminars done by second years, and journal cups being done by first years.
Okay.
So this is how
Distribution.
academic distribution is being done.
Okay.
So all the new journals which are being published has to be addressed in the
Okay.
new journal clubs every day,
Okay.
every week.
Every
We
week.
have a 1 day journal club, one day seminar of any topic, and 1 day a case presentation. So this is how it is being done by second year, third year, second year, and a first year.
Okay.
And this is our department academics. So other 3 days are combined academics.
Overall
So,
NIMS.
yes, combined academics of NIMS. So wherein the special day at NIMS is Thursday. Thursday is considered the big day of NIMS. Every week Thursday is considered big day. So we have a good learning center at NIMS. It is like an auditorium, small auditorium, or a learning center at NIMS, where it is a primary area for our combined academics going on. So it is
So
where
mortality meets.
yes, exactly. The mortality meets, presentations going on, several talks going on, the CPCs going on, your autopsy conferences going on, your hematology conferences, your tumor board, your all combined classes will be going on in Thursday. So Thursday is an important day. Along with Thursday, you have a Friday. Friday is a radiology conference. So we have every Friday we have a medicine radiology conference going on. So we have in medicine radiology conference, medicine resident and the radiology resident are combined together to present a case. So the clinical history and treatment part is being provided by general medicine resident, and the radiological discussion will be done by radiologist. By that there is synchrony between the two branches, and there is a dedicated medicine radiology conference on Friday. And Thursday is a very good big day at NIMS, where
lot of learning,
lot of learning activity, but by all the stalwarts at NIMS are being done. So 3 days of at least 3 days of combined academics, where an entire which is in learning center, and 3 days of academics at your department. So it sums up around 5 to 6 days of academics per week, 8 to 9 per day.
That's
from 8 to 9 o'clock.
I think that's a lot of academics, and even if we go through the academics regularly, we get a lot of knowledge, even practical and theoretical.
Yes. By just being there, present over there, just trying to understand what's going on, you tend to know that everything is very vast, everything is very diverse, and you have to know many things more. So you just know a little of it, and you have to learn more. That is what you try to get out of it.
It's regarding the thesis topic. When you look at the thesis topic, and when you submit the protocol.
Yeah. So thesis is mandatory everywhere. It's all over India. As a postgraduate, you have to be doing some basic thesis,
research work.
Basic science research has to go on as a part of your curriculum. So that is everywhere. So the same thing we have it in NIMS. You will be allotted a professor from your department as your thesis guide.
Okay.
Yeah. It's by the end of your first year. I mean, end of your first 6 months of NIMS. First 6 months, you are allotted a thesis guide.
Within 6 months, mostly you will get a thesis topic.
Thesis guide you will be getting, and you have to finalize. You have a ethical board over here. You have
scientific committee,
review committees over here. By that time, you have to make sure that you go up with a
topic and a protocol.
Yes, good protocol, good thing, and submit over there and get your ethics and budget approved done. then you can go on with your thesis. Thesis is very mandatory.
In
Thesis, yes, it is mandatory.
When do you usually like most students, when do they finish thesis? Like before
Yeah.
final exams?
So it is, your thesis topic is given 6 months after joining at NIMS, and you are asked to submit your final thesis output 6 months before you're finishing your residency.
So you have 2 years to complete it.
2 years to complete it. Ideally, 1.5 year to 2 years is the ideal time for you to complete your thesis.
Okay. And coming to your seniors and colleagues, how is the work culture in a department?
Yeah, we see basically we have three batches: third year, second years, and first years, like anywhere. But one of the batch is not in department, because
Peripherals.
one of us will always be in peripherals somewhere around her. So at any place you have two batches going on, either a first year or a second year, or a first year and a third year.
Okay.
So first year is always in your department, and there is either a second year or a third year being based on their peripherals. They will be with you. So at any place, in any place involved, you have a senior, junior going on. So two batches are posted at any place. So it's nice. So they are the ones who underwent first year. They came to second year. That's nice. They are the ones who are equally good, nice, or brilliant as us, and
so they become like friends of
definitely
yours.
The culture here is very nice. Toxicity is absolutely not there. It's good. It's good over here. You as a senior, junior, you generally have those different. You have the rapport. You have differences also.
Opinions.
Yes, your first year resident might be able to have to work more, because his area is in documenting
more of documentation.
Yes, writing a case sheet, giving a discharge summary and all.
The groundwork.
Groundwork is basically done by first year. So,
and one thing I know, the thing is there is no interns, because there is no NIMS Medical College.
Yeah,
so as interns are not there.
Yes, in NIMS, NIMS doesn't have a UG going on. It doesn't have a medical college, and it doesn't have a medical school, so it doesn't have undergraduates over here, and there are no interns available over here. But you never notice.
So the work will be little more for a first year resident.
Generally, yes. Like that. But the thing is, the staff over NIMS is very good. The support staff, the nursing staff are very good at NIMS.
Skilled.
So very skilled, very good at NIMS. All the sampling, I've never touched a syringe since 2 years.
I think in like even in PGI, what I have heard from my friends, because in the first year, lot of because they too don't have a medical school backing up.
Yes.
So interns not there.
Yes.
But they do a lot of sampling, especially in the first 6 years. They carry a lot of models in apron and do sampling till almost 10th or 11th. So, but I think, is it like that?
No. That is absolutely not there. In NIMS, it's a good thing. I personally never have done a single sampling in 2 years at NIMS. So you have a good nursing staff going on here. Even the nursing staff to patient ratio is very good over here. So maintained over here. So you have them working efficiently. All the investigations are sent by them. Even
treatments?
Yes, treatments are given by them. Sampling is done by them. Even this putting a mild interventions like Foley certain times is done by them also.
But hectic,
even they could help you in that. So they are very skilled. Staff over NIMS are very skilled. Certain times I would feel they know many things. So
they understand your instructions.
Yes, they understand our instructions. They can very much manage a DKA case properly. They look for VBGs. They look your GRBS hourly correction. The amount of correction is going on.
So they can lot of they support you so that your stress will
decrease. Definitely the stress. I mean, if you have a patient who's in sepsis and on inotropic support and requiring regularly hourly monitoring, the nursing staff is so good that they monitor it very effectively every hourly, and repeat VBGs and ABGs regularly. Look for your GRBS regularly. So staff here at NIMS is nursing staff is very supportive, and I have never felt that someone like an intern is not available for me to share my work. So that is not there. My work as a first year resident will be to properly document everything. How the patient was there, writing a proper case sheet is my responsibility. Putting a diagnosis and treatment and changing plans is your senior's responsibility, and your discharge is your primary responsibility. So here we have a documented discharge going on. We have to type a discharge. So
Second thing, sorry to interrupt. You have evening rounds.
Yes. So evening rounds generally are rounds in wards. We just have rounds once a day, but that will be a good long rounds. Yeah, long rounds going on from 10 to 1. At least 3 hours of rounds would be there in the morning. In ICUs and emergencies, you have rounds going on twice. So first in the morning it was done by consultants, and in second year you have your SRs who would be taking your rounds again at 6 to 7.
Okay.
So you have daily.
So you can send like if you find any new development in the investigations you have sent in the morning, you will change the treatments in the evenings.
Yes, evenings. It's not just in the evenings. Even in midnight also you change the decisions. So that
investigative backup
is very strong. It's very strong. It's very fast.
Okay.
So here
all phone call.
Yes, we have a good internal communication going on. We have a good intercom as well. So
even online reporting of
especially the laboratory investigations in NIMS are given in your app itself. We have a dedicated app for NIMS where all your investigations which you have sent will be received back within 4 hours. Any CBP
that helps a lot.
Yeah, that definitely helps a lot. Any CBP is given back in 2 hours. All your routine investigations, biochemical and pathological investigations are given within 3 to 4 hours itself. And you have duty mobiles going on everywhere. Okay. So we have someone who is on duty after 6 when someone is on duty. You have a duty mobile going on. You have a radiology duty mobile. You have a general medicine duty mobile. So every department has a duty mobile going on there. So proper internal communication is there. So any query you required, any consultation you require, you just need to call the duty mobile over there. The resident over here has to come, has to see anyone. Okay. So if at all I am a resident posted as a general medicine resident on duty posted, if then anyone who calls me, someone from other department calls me, gives me a consultation regarding an infectious consultation going on, consultation for infectious diseases, consultation for anything, have to be there with the mobile. So picking up the calls and make sure that is done by night 10
the patient. So the patient care is more effective.
Good internal communication is there.
It is said that most people, those who do residency in general medicine residency in NIMS, definitely do super specialty. So does NIMS help in acquiring super specialty seats, like ranks better, or what is the fact?
Yeah, thing is, any first super specialty, either you give it through NEET SS or INASS, it has to be. It's a competency exam as well. It's again a MCQ based exam where you have to perform individually. So it's not that someone from NIMS is at a more advantageous state and all. But the thing is, it all depends on the individual getting a rank. But the thing is, for the last 2 times, it was from NIMS only we had All India first. So the last NEET SS All India first was from NIMS, and the previous one was also from NIMS. So it doesn't mean, but they were really good. They were really good seniors who had done their job exceptionally well. But I would feel rather than giving, it gives you advantages. It puts you in an advantageous situation by making you well versed with your super specialties. So as you are posted as you have very common and frequent interactions with your SRs who are doing super specialties, it gives you very much clarity on the branch which you want to
super specialty branch.
Yes, and it gives you very much advantages and disadvantages about the branch you want, and that makes you decide onto which branch you want to pursue. So you take decisions, you take good decisions, you take decisions early. So by that, and with good academics and all, it will propel you to get a good rank. It's not like someone from NIMS who always gets a good rank. It is always based on the individual only. But yeah, the exposure over here will put you in a more advantageous situation of knowing what you want for yourself, and making you work for it, and being in an advantageous position by starting focusedly and starting early. That's okay.
So this is Dr. Kaushik. I think most of your queries related to general medicine and NIMS hospital have been addressed by him, and he gave a very genuine and wonderful experience of him in NIMS. Thank you, Kaushik, for your time.
Yes. So
Any
I
advice
would
for?
just like to conclude. First thing, after your NEET PG, yes, you have given your NEET PG. Then you are moving to other phase of your life where you are pursuing your post graduation. That first thing you have to decide is your branch only. You have to decide on your branch. It doesn't matter where you are doing it from. You have to be very sure that what you want further, because that's the single big decision you are going to make, and you have to pursue it further. So first decide on your branch. If you are deciding for general medicine, I would say then you are taking up a right decision, a tough decision, and a equally good rewarding decision. General medicine as a post graduation, I feel that is the best, and I have taken it. So I would advise you, for someone who wants to pursue post graduation, MD internal medicine is a very good one. So after that, the college and all, at NIMS, I was lucky enough to get into NIMS by getting a good rank at that point in time. That was, some certain times you have luck also playing
Factor.
factors to get into NIMS. So I was lucky enough to get into NIMS. So for someone who had a good decent rank, uh, below 200s or in and around 200s and 300s, and who are eyeing to take general medicine, within these two states and all, to Telugu speaking states, or even the South India where you are wanting to take general medicine, I would generally put NIMS as a first place in South India. I would definitely put NIMS as a South India for many advantages it provides. For the academic curriculum it has, for the work culture it has, for the city which is based it
Okay.
in. So everything is an advantageous position only. And even yes, definitely it is on par with all the colleges of national importance, like JIPMER, PG, and NAMES. So if you are eyeing for an INI, you have to be strong, be eye for an INI set. You try to prove yourself even there. But now you want to settle down with NEET PG, and you want to settle down with internal medicine. And if you are in a good rank position, and if you had any queries regarding general medicine at NIMS, I would definitely say it is the best best decision you can make. You can definitely take general medicine at NIMS. It's very good for you. It will be very rewarding for you as well. So there is no confusion regarding which if you are getting a medicine
But
seat at NIMS, then you can take it off blindly.
okay.
That's
Thank you
what.
very much.
Yeah.
Thank you very much, Kaushik, for all your genuine info. Okay, guys, we'll bring up next more enthusiastic and more achievers to you. Stay tuned. Thank you. Thank you very much. Guys, please do like, share, and subscribe. This will encourage us to do more content. Thank you very much.
Like, share, and subscribe to Osmania Docs.